Now, with that, we'll move to health matters, where no fewer than 90 schoolgirls in a Kenyan school have been reportedly ill after having difficulties walking. Kenyan health authorities say the health crisis is currently under investigation as the students have been admitted to hospital. The female students from Eregi High School, that's Eregi Girls High School, located in the western part of the country, were reported to also show symptoms of knee pain. Earlier on Tuesday, a senior official from the country's Ministry of Education who visited the school assured the worried parents that the situation was under control. He said classes would continue as normal for other students. Now, joining me on the news to discuss this is the Secretary General, Kenya Medical Practitioners, Pharmacists and Dentists Union, Dr. Davji Bhimji Atellah. Thank you so much for joining us, Davji.
Yeah, thank you so much.
All right, now, doctor, from an expert's view, what sort of illness could affect that high number of people, causing them to have difficulties walking?
I think these numbers that are rising on Monday, and then there were more on Tuesday, more, I think, yesterday, that is Wednesday.
Oh, wow.
And when this started happening, there was a lot of interventions because the students were being admitted to different facilities to check or to confirm if there was any contagious thing that was causing this particular pattern of their infection. So initially, from the results, from the labs, there was really nothing that was coming out as infectious among these particular students. And in a great way, even I'll call it the National Research Unit, that is the Kenya Medical Research Unit, picked samples from the number of these students to go and investigate. But then later on, based on this particular case, it came to be realized that their pattern of action was more related. And it is now being more concluded that it seems like a mass hysteria. And this is because all the lab results that are being done normally in the hospitals were coming out to be normal. And when I was having a discussions with a doctor who was treating a number of them, I think about 40 of them, he was indicating that some were even showing signs of convulsions. But then when they were given the anticonvulsants, then they would respond. But some also, when they were given what we call the placebos, that is just the normal saline, they will also respond. So it's coming into a conclusion that it's probably a mass hysteria that is getting down among those particular school-going children, and therefore it's something that's now being managed. And mass hysteria tend to be contagious among the girls who actually work study in the same environment. And that's why numbers have been increasing consistently. I saw yesterday that the Ministry of Education closed the school for this week for those who are in Form 1s, Form 2s, and Form 3s, probably to help manage the situation that was ongoing. But so far, there's nothing medically, nothing infectious that has been identified in the ongoing case among the students.
All right, quite a disturbing situation there. Now, you talked about, this illness being, contractable. Tell us, what are the precautionary measures that can be taken to actually tackle this illness from spreading?
It's majorly more what you call mass hysteria, which means that it's more mental, it's more psychological aspect that brings about the situation. It's really not an infection that can be identifiable. So mostly, it's much easier to have a mental discussion among these that are affected, and also among the schools. So what is really bringing that fear, that bringing the psychological perspective that they are infected with this condition? There are a lot of, I would say, superstitions around when they are seated, they do not show any symptoms. And it's only when they are walking that they are showing that they have that muscle problems, that they are indicating this. That's why it is more of psychological mind that is the psychological mindset on the situation, which now is being really managed. And there's also an aspect of superstition that was attributing to this mass hysteria that's being reported. But that is because there's no any contagious, or there's no any, I would say, there's no any infection or infectious element that has been identified. The contagion results into more of integration together.
All right, thank you for clearing that for us. Now, can you give us an update on the affected schoolgirls? Have they recovered from this illness?
As of today, after around 1 p.m., when I was talking to some of the doctors who are managing them, they were not being given any treatment, because initially when it started, there was a bit of panic, and therefore they started giving infusion and started managing as if there was an infection. But once that was realized that it could be a mass hysteria, the management by any medications had been stopped. I think that as it goes, and as a psychological aspect of it is being brought on board, then we expect a little bit more of a change to the situation. Also, those other students who are in school, the school was closed, then to allow them to really go and be in a different environment for the same to manage the situation.
All right, thank you so much, Dr. Davji Atellah, for joining us on the news today to actually speak on this.
Thank you so much.